I hope wherever you are, you're staying safe, acting smart, and keeping strong throughout these very challenging times. I'm going to take a tip from everybody on this platform that is trying to help others out with information as much as possible, and I'd like to give you a quick update on how managed care is being affected within skilled nursing facilities and the healthcare environment. But first, we must talk about Medicare and understand what changes have been put in place by CMS. There is the 1135 waiver, which was put in place to ease some of the restrictions in regards to how skilled nursing facilities can treat Medicare members. For the most part, the 1135 waiver allows the 3-day qualifying hospital stay to go away, as well as the 60-day wellness break that's in between benefit periods for a Medicare 100-day benefit period to also be looked aside, as long as, and this is important, as long as the resident in your facility qualifies or falls into the category of someone that was affected by the coronavirus. So it cannot just be anybody, but it has to be somebody that was actually affected. It doesn't have to be directly, but can even be indirectly affected by the virus, is why you are looking to continue their coverage. Another thing that's important, because I was asked by a facility yesterday, is that if you have a Medicare member that is no longer skilled and really can be discharged and moved to a lower level payer, the 1135 waiver will not allow them to remain covered by Medicare. It's only for those that have a skilled need. And finally, there are other things that the waiver allows for in regards to PDPM assessments, as well as a few other things, but I'd like to simplify it and just discuss this. In regards to managed care, we've spoken to many insurance companies yesterday, and for the most part, firstly, understand that most of the insurers do not require a 3-day qualifying hospital stay for coverage, so therefore that portion of the waiver is not really relevant. It's important to know that as of now, the pre-certification and extension process in order to maintain authorizations is staying as it is. There is something to keep in mind, is that there will be more likelihood of residents that will be admitting from home versus from the hospital. Typically, the hospital will have a lot of the medical records to submit, so when you're getting a pre-certification now from the insurance companies, make sure to submit whatever medical records the resident does have. It could be their doctor's note, it could be any other medical records that will justify the need for them to be in a facility, and the insurance company will review that and take that into consideration. Obviously, if there's any extenuating circumstance or something that needs to be addressed because of the current situation, they will look at that and make a case-by-case decision. One more request that insurance companies had is that if any of your residents do test positive for coronavirus, to immediately inform the insurers of any of their members that are in the facility as well. They need to be aware of this, they need to be notified, and they need to move this up the chain to whoever they need to notify. So please be vigilant about this, and if you have anything else to add in regards to this that I may have not mentioned, please mention it in the comments. And in general, just like we're doing here, trying to give helpful information for those people that we can help, please do the same for your field and your area of expertise. If you have any information that can help other people, now's a great time to do it. Thank you so much.